and welcome to the November 2023 edition of Room for Everyone, the video podcast of the Immunologist. No wait, that's not quite right. Or is it? Well, anyway, every month we go over all the cool things that are happening within the pages of the Rheumatologist, your favorite rheumatology paper. I'm your editor, Dr. Kumar. Before anything else, I'd like to introduce you to Dr. Lindsay Moy, an incredibly hardworking fellow here at the Rheumatology Fellowship at the University of Iowa. She's coming up from clinic, but she always has a moment to ask you her favorite question. Lindsay, take it away.
What is your favorite white blood cell, and why?
So viewers, just take a few seconds, just dwell on the topic, and I'll count to 5. So Lindsay, what's your answer?
My favorite are B cells, because they make cool things like antibodies.
Are you CD20 positive? Okay, I'm sorry. I just couldn't help that corny joke. But in all seriousness, I want to mention that Lindsay is not only an outstanding fellow, but also an outstanding B cell. So how about you? We are interested in hearing your answers, so please interact with us on social media and tell Lindsay and I what type of white blood cell you are. The reason we love this question is because it shows not only your personality type and your reasoning abilities, but also the great personalities that we imbue into our own immune systems. The immune system isn't just a sterile chart of proteins and other bric-a-brac to memorize. It's a series of interlocking stories and narratives at the microscopic scale that make Games of Thrones look like child's play. But you only get to enjoy it when you learn enough to ask the right questions. In this month's Ruminations, we'll help answer a lingering question that many of us have had since medical school. Immunology. What is it good for? There's also a lot of other great articles within the pages of this month's issue. What is pneumatosis cystoides intestinalis?
How is alcohol consumption related to osteoarthritis?
Is there a role for ultrasonography in differentiating Sjogren's disease from IgG4-related disease?
Can treat-to-target strategies lower the risk of fracture in patients with gout?
Why should you volunteer to be on the ACR's Committee on Education? That and so much more in this month's edition of The Rheumatologist. So please enjoy. Take a seat, make yourself comfortable. After all, here at The Rheumatologist, it's one for all and room for everyone. Happy reading.